Recharging the Human Battery Radio. I'm your host, Dr. Stefano Sinicropi. We are on AM 950 radio, and this is really, I think, one of the most important radio shows that we've done here today. So I'm going to talk about something that is really, it's not just the future of medicine, it's really the now. And I'm talking about regenerative medicine. I mean, you've heard about it, stem cells. Those of you that, listen to certain, kind of media outlets and things like that, the Joe Rogans of the world, but also if you look at a lot of the famous, athletes and celebrities and just A-listers in general, I mean, they talk about regenerative medicine, longevity, stem cells, those kinds of things. I mean, it's everywhere. And we've had a show before, really talking about biohacking in general, and regenerative medicine is really a little bit more, specific to a certain concept. But as you guys remember, we talked about like Tom Cruise. Why does Tom Cruise look the same, in Mission Impossible, whatever the number, is up to? I know they did the final episode, but the same as he did in Mission Impossible 2, which was like 20-something years ago, or whatever it might be. And that is because people that are in the know expose themselves to all kinds of therapies and treatments that not only can keep them young, but can target things like pain and injury, and they can avoid surgery, and they use it for cosmetics and all kinds of other things. And these things are available today, but unfortunately there's so much misinformation out there. Now, recently you saw the New York Knicks, by the way, my hometown team, okay? Thank you. Won the NBA championship, and I actually recently was talking about Karl Anthony Towns. Obviously a hometown hero here. I think that trade was a really bad decision. By the way, that's for another show. We'd talk about that on a sports show. However, Karl Anthony Towns in 2022, when he was here in Minnesota, had multiple injuries. In fact, he was dealing with 5 different body parts. Instead of choosing to go down traditional routes or considering surgical options, he actually went down the regenerative path and did stem cell treatments and things of that nature, things we're going to talk about in today's show that are available to all of you guys right now. And guess what? He was able to come back. He had no surgery, and now he's an NBA champion. And he still hasn't had surgery on any of those things where he ended up having, regenerative medicine options. So whether it be for improving our longevity, targeting orthopedic issues, which I'm going to talk a lot about. Now, you're talking about hip arthritis and spine issues and knee problems, all kinds of things where regenerative medicine is fantastic at addressing these problems. Again, in 2026, not in 2036, today. These things are available, but also in so many different diseases and conditions that afflict the human population. We're talking about neurological diseases, movement disorders, depression, anxiety, PTSD. There are all kinds of other things that we can target. All kinds of chronic diseases can be approached with regenerative medicine options because our bodies have the ability, if placed in the right situation, to heal itself. And regenerative medicine is just giving us a tool to help the body to heal itself. That's how we've been here for such a long time. So on the other side of the break, we're going to go into what is regenerative medicine, what are stem cells, how are they delivered, what's the difference between stem cells and things called orthobiologics, which are not stem cells but products that can be used to create regenerative, medicine outcomes. And we're going to talk about some of the real data. Now, I can't go through all of it. I mean, there's so many studies I'd like to talk about. We'll go through a couple, and then we'll talk about how you guys can access these regenerative medicine options yourself. So we'll see you on the other side of the break. We're on AM 950 radio. This is Dr. Sinicropi, recharging the human battery. We'll see you on the other side. Charging the Human Battery Radio. We're on AM 950. I'm Dr. Stefano Sinicropi, your friendly neighborhood orthopedic spine surgeon, integrative health specialist, whatever they call me these days, or I call myself, or whatnot. But listen, I love doing what I'm doing right now and trying to educate you guys on what's possible. Before I even get into it, I recently last year I did a stem cell talk on spine. This was actually here in Minneapolis. It was the Minneapolis TEDx. They actually do a really good job of it, and I can tell you that I couldn't have been more excited to give that particular talk. Is the TEDx format my favorite format? Not really. I like to talk more like we're talking now because we can just kind of go in and out and talk about different things. That's a lot stricter format. But it was really my first big opportunity to get out to the world some of the studies and things that are going on with stem cell treatments in spine. And I can tell you, before we dig into it, as a spine surgeon, it's made a massive difference in the way I practice personally, because there's a huge gap between kind of traditional options, and when I'm talking about traditional conservative options, the therapies and the epidural steroid injections and those things, and then having surgery, there needed to be something in between. And that's been this big quest to try to find options for people to really give them solutions before jumping into major surgical endeavors. And the exciting thing is, now that I've partnered with regenerative medicine, people really all over the country, getting to know people, getting to understand their clinics and what they've been able to see, the excitement that is really growing out here is that over time, and not a long period of time, we're talking over the next 5 to 10 years, so many treatment options are going to really shift from heavy procedure and surgical options into regenerative medicine options. Now, I'm going to say this. One of the things that has slowed things down is whenever there are growing technologies, and something that's growing very rapidly, by the way, because regenerative medicine is going to grow at a speed. I think everybody is going to be surprised at how fast this is going to grow, because obviously it's always more beneficial not to have a surgical procedure, even though there are so many different people that absolutely require surgery, and that's where I come into play on that end. But bottom line is, people are looking for options that are non-surgical, but they're also looking for options that actually work. And a lot of traditional conservative treatments just plain don't work. How do I know this? I've treated 25,000 patients in my career. I've done 10,000 surgeries. You kind of get a sense to what works and what doesn't work. And unfortunately, a lot of the tools that I was using to try to help people to prevent having spine surgery were not effective. And so, in a way, it's great at getting a lot of spine surgeries done, but it's not necessarily great for the patients if there could have been other options that could have prevented them from having spine surgery in the first place. Now, I will tell you, the same thing is going on in orthopedic surgery. There's so many options for knee arthritis and shoulder, rotator cuff tears and arthritis, and basically name a joint. Yes, the answer is yes. I get this asked quite constantly on social media when I post about the knee. Can I do this for the hip? Can I do this for the wrist? Yes, and yes, you can do it. Now, some people just absolutely need surgery, or you may not be a candidate, but most people are. We'll get into it in a little bit, but I want to make this comment because it's really important. One of the reasons that there's misinformation and things are being slowed down, I'm going to talk about the two major reasons, is number one, as far as funding, a lot of regenerative medicine has to do with using your own body's stem cells, okay? And so, unfortunately, big industry is not involved there. So if it's between you and the provider, there's not that massive amount of money that is going to be spent. So there's always a financial, issue going on. Now, there's other products out there. They're different. Those companies are nowhere near as big as what we see in the pharmaceutical industry. So unfortunately, the size of these studies that are done and these randomized controlled studies, they're slow to come because the funding necessary for it is massive. So just keep in mind, one of the reasons you're not hearing about it is because the money is not quite there. And so, like anything else in the world, right, what you see on TV, right, what you see on Super Bowl commercials, those are not mom and pop businesses advertising for it, even if they have the greatest product ever. Right, you're seeing Coca-Cola and crypto and whatever else is on the Super Bowl. So just keep in mind when you're hearing about different options that there are great options that you might not know of because there's not enough money out there to get the information out. So that's one part of it. The other part of it is on the medical community side. And this is multi-pronged. Number one, the medical community, unfortunately, is part of the general society. So if there's misinformation in the general society, then we're all humans, right, as physicians and whatever provider you might be. And so you hear things and you kind of tend to believe it. And again, we tend to believe misinformation as it circulates around. The more we hear it, the more we tend to believe it. But the other thing is that there are, people, obviously, if you are involved in a profession that relies on doing, procedures and things like that, you may, for whatever reason, be very concerned about the unknown because you don't know what's going to happen if people start choosing those things versus choosing to have procedures done or whatever you may be offering. Well, I'll tell you, that is absolutely not going to happen, and I'll tell you why. The baby boomers are becoming older, and as they age, there are the number of procedures that are necessary where people absolutely need surgery is going to become so staggeringly high. Okay, that we as physicians, we can't even begin to keep up with the number of people that need surgical interventions, whether it's orthopedic surgery or spine surgery or whatnot. And so I think that what we need to do is offer the best tools to the patients because, to be honest with you, the system cannot handle the number of people that are coming in that need orthopedic-related procedures. We literally can't handle it. Financially, we can't handle it. Manpower, we can't handle it. There are just so many things we can't handle. So I think regenerative medicine, biohacking, all this other stuff we talk about gives us other avenues to keep people away from some of the more expensive procedures, which is not only going to help the patients, but it's also going to help the system, which is already a $4.9 trillion system and growing, but it's going to break. If you think about like how we're subsidizing stuff. If you think about, Medicare and Medicaid, how strained they are, how strained hospitals are, how strained everything is. If we don't come up with creative solutions, we are going to not only do we have a population that's unwell and having a lot of medications and procedures, but we also have a society that is going to go bankrupt because I don't know who's going to pay for all this stuff, which is why if you haven't noticed, your insurance companies, your premiums are skyrocketing and the service that you're getting sucks. I don't know how else to say it, right? You're starting to get services cut off. You're all shocked that things are getting denied. So the best thing to do is try to be in a position where you don't have to worry about things being denied or not denied and really look at options that may, help you, even if there has to be an investment behind that. All right, let's get into now that the tirade is over. Let's get into regenerative medicine in general. So what is regenerative medicine, right? So our body has the potential to heal itself. We've been around as this species, like what you look like, right? You walk around, you see people. Guess what? We've looked like this for about 300,000 years or so. And before that, it was different, different. We look different, but for 300,000 years, this is the bodies we've had. We've been able to survive through that whole time. Viruses, we've lived next to volcanoes, we've been poisoned by stuff. Well, all these things happen. Same thing with other species that continue to persist. Why? Because we have the ability to regenerate ourselves. Let me give you the most simple example. People love this. People say, well, what's regenerative medicine? Well, I'll tell you what the idea is. We can heal ourselves, right? You cut your finger, right? First it bleeds, clotting factors come in, you get a scab. Guess what? Your stem cells go to work. And so you have these things called mesenchymal stem cells, which we'll talk about in a minute. These are adult stem cells. They start producing chemicals that then bring all the needed, raw materials in, and all of a sudden the scab falls off, the skin heals over, it repairs, And this is what we are targeting when we are talking about stem cell treatments. Because if either we give stem cells or we give molecules or factors that stimulate those stem cells to work better, then we can create that healing process. So imagine the process of your finger healing, that little paper cut that you have, right? It heals, right? And it heals pretty rapidly. Now imagine if we take those substances, including the cells that are creating that beautiful healing. What if we take all that stuff and just throw it in your arthritic knee? What happens there? This is the kind of the idea of regenerative medicine. What happens if we take these cells and these things and put them in your cerebral spinal fluid and wash, your brain cells with it? Then what happens? Can we repair? Can we, reverse things like traumatic brain injuries and movement disorders, and other things, or at least help to slow down those processes by stimulating what has kept us around for 300,000 years? This is what regenerative medicine is all about. And that's why if you really do a dive and you go on social media and you look at these other things, you're going to see so much excitement behind regeneration and stem cell treatments and whatnot. I can tell you another good example is stem cell treatments are being used in burns and open wounds where you put stem cells, right? Now you're explosively increasing the amount of signal that is then signaling the body to heal. And we can do that in different parts of the body. Now, if we look back at the, like way back, I mean, I don't know if you guys have heard of Prometheus, right? There's a movie, Prometheus. Everybody's always looking for, the Holy Grail, and everyone's always trying to become, like Wolverine, where we can kind of regenerate ourselves. But let's talk about the myth of Prometheus, right? The guy was chained to a rock, and an eagle eats his liver every single day. But every single night, it grows back. So the Greeks already understood, which is very interesting. I don't know if they actually had science behind this, but they understood that the human organ, the liver, actually can regenerate itself. You can actually donate 60% of your liver and it'll regenerate itself. So it's not just science fiction, it's actually happening. And how does that happen? The stem cells behind it it's fascinating, what happens. One other little nugget that you guys might not know is if you're less than 2 years old and you cut off the tip of your finger and you just leave the wound open, the fingertip will actually grow back with the nail. And it'll look fairly normal. Now that starts to go away because our stem cells start to change, but this is the power of stem cells, especially some of these younger stem cells, which we can use for more, serious conditions, not necessarily orthopedics and things like that, but there are so much to go down there. That's for another discussion. So let's talk about conventional models. If you look at a conventional model, and this is really what I want to focus on. So a conventional model, let's just talk about a bad joint. Okay, what do? You have a bad knee, you have an arthritic knee, you know it, right? Your uncle who's always limping around, everyone's like, when the hell are you going to get your knee replacement? Like, what are you doing? Like, you can't even walk. So what do? We manage the symptoms, anti-inflammatories, cortisone, and then opioids if the pain is so bad, like that people can't even work or function. But then eventually you remove and replace the part. Okay, joint replacement. Now, there's same thing with spinal fusions that I've done, thousands of, right? We get to a certain point, say that we got to replace it. And yes, absolutely, in many cases, these things are 100% necessary. However, what if we can look at a regenerative model? It's a completely different way of thinking, and it's totally changed my approach to how I look at patients. What if we go in and get the growth factors, we get those signaling molecules and those progenitor, I mean, that means like basically like the parent of, cells and these stem cells to change the healing environment and restore the tissue. Now, forget the claims that you see because people are out here making ridiculous claims like we're not going to inject stem cells and you're going to grow a new knee or anything like that. But the goal is if we can slow down processes, decrease pain, and maybe get some regeneration, you certainly can with other tissues, but I'm talking about arthritis itself, or you can prevent, for example, in the shoulder, if you have arthritis, it's very clear if you do stem cells in the bone, the shoulder head, the head of the humerus won't collapse over a long period of time. Whereas if you don't do stem cells, you're pretty much destined to have a total shoulder replacement. What would you rather have? Would you rather go the conventional model, or would you rather go the regenerative model if it is something that, is optional? So let's talk about, I just want to break down like the umbrella, because these are questions I guess asked all the time. Let's talk about the different, kind of categories. So, stem cells. I keep saying stem cells. That's only one category that's out there. Those are actual cells. So those could be harvested from your own body. Typical areas to harvest it from are your bone marrow or your fatty tissues. And then those cells can be delivered to an area. Those cells then do a process called homing. They actually have an internal GPS, and they find areas of inflammation and damage, and they actually go and live there. That process is called nesting. It's fascinating. And then they set up these living pharmacies that start putting out all kinds of molecules, and they tell the body to heal. They tell the immune system there to heal. They bring in the things that are necessary for healing. That's cell-based therapy, and then there's something called orthobiologics, okay? Orthobiologics are things that you've probably heard of, PRP. We'll get into PRP. Most of you have heard of PRP. Different types of products that can be harvested, for example, from the placental tissue that are not per se the cells, but things around the cells. I mean, these are really the big ones. And then you have things like just signaling molecules, things like exosomes, which you might have heard of, or growth factors. Now we have things like tissue engineering, where you can take certain types of tissues, convert them or engineer them, or create a scaffolding. So, for example, when we look at stem cell treatments for the spinal cord, the problem is if you have a spinal cord injury, everything is disorganized. Okay, just imagine, right? You want to make sunny side up eggs. Right, it's pretty, right? You get the nice thing, you get the egg yolk in the middle, the white stuff. But just imagine if you want to kind of organize those, you say, okay, I have 4 eggs, I'm just going to put them in this pattern. But if I scramble them all up, then what do you do? Like, I can't make those patterns anymore. That's what happens in a spinal cord injury. And so the idea behind scaffolding or building specific tissues, and this is really complex stuff I'm not going to get into, but really fascinating. And I'll talk. You'll see me talking about this on social media and other avenues. Is in the spinal cord, you have to build specific scaffolds where the actual stem cells can grow. Otherwise, they don't have a path. If you put a stem cells into a disorganized mess, they just do random stuff. But so they need a guide. So you can have, like, so let's say the stem cells are the cars. You need to put them on the road. Otherwise, it's just, random. It just looks like, you went to some festival, right? Everyone's parking anywhere. It's random. There's no rhyme or reason, but you need a highway that they can grow and develop on. And so these are the scaffolds. So, for example, you can create kind of superhighways inside the spinal cord area where it's damaged, and then put stem cells that will then grow there and regenerate the nervous tissue right along those pathways, and hopefully be able to reconnect that and give people functional abilities back. This is absolutely coming. AI is making it come a lot faster. We're able to engineer things so much faster. The speed of this is going to be really, really fascinating. And I don't know if you guys are into the movie Avatar, but it's really good because he keeps saying, right? Remember that the guy, I forgot his name is. He's like the big general. He's like, son, we're going to get your legs back, right? Because people that have spinal cord injuries are going to eventually be able to, quote unquote, get their legs back as long as there's enough, of the spinal cord left that you could put these scaffolds in and stuff. Now, this is a little bit far down the future, but it is something that is coming. And kind of the last bucket that I want to put in here are gene therapies. We're going to be able to use all kinds of genetic engineering and manipulation of these cell lines and these different tissues to create very, specialized things, which I think are going to be really important in solving things like Parkinson's disease and other things where you can create a certain stem cell from a different stem cell by either genetic engineering or using viral vectors. There's so much incredible work being done. It's very, very exciting. I've had some of these people on my podcast, and it's hard not to get excited because obviously ending human suffering is my primary goal. That's why I'm so sucked into all these projects I'm doing, because I'm really trying to help to diminish human suffering as much as I can. I'm just one person, but certainly with enough of a platform, you can reach millions of people if the message resonates, and that's what we hope to do. So again, conventional medicine is absolutely brilliant. When we talk about as a rescue, imagine days before, like before total knee replacement, once you got to a certain point, you're not going to walk anymore at some point. So yeah, knee replacement's good, but it comes with downsides of having surgery and stuff. So what if we can, do better? So let's get into kind of like stem cells 101. I want to dispel some myths. I think I'm going to have to do another show because clearly there's so much to talk about on stem cells. It's crazy. There are still people out here that are jumping up and down about these embryonic stem cells. Embryonic stem cells are the cells basically that you see, like that those diagrams you see, or you remember the pictures of the embryo as the cells are dividing. Those are embryonic stem cells. They literally can become anything. Okay. Those are from days old embryos. They can become 200 plus different types of cells. They have maximum flexibility. These are absolutely not the cells we are using. So anytime I speak or I do a post and people are like, oh my God, it's unethical, embryonic stem cells, you're going to cause all this stuff. That is absolutely 100% not what's being used. No one is using that in the regenerative medicine fields. If you put embryonic stem cells in, all it does is form something called a teratoma, which are these crazy tumors that have all kinds of different cells in it, including teeth and heart cells and all kinds of crazy stuff. It's not what we are doing. Then the next level is something called pluripotent stem cells. So you imagine those embryonic stem cells are the parent. And then the kids of them, right, are then these pluripotent stem cells. And I'm trying to do this in more lay terms because otherwise it's a 10-hour, dissertation on kind of how stem cells work. Bottom line is pluripotent stem cells are interesting because they don't have as much a variability as the embryonic cells, but you can actually program adult stem cells into pluripotent cells that then can become other things. Now, this is not what we are using when we're talking about injections for knee arthritis and hip arthritis and all these other things, but it is fascinating in research. So, for example, you can take skin cells and you can reprogram them, and then a neurosurgeon can implant those into the area of the brain that is affected in Parkinson's disease and potentially reverse some of the symptoms. Now, that obviously is very complex. This is way in the research category at this point, but the speed of the research is moving really, really fast. And for those of you that have relatives and friends, and you yourselves are suffering from some of these horrible conditions, I'm telling you, help is on the way. I don't know how quickly it will come. There's a lot of other things to do for those things, but I mean, like potentially solving some of these things is absolutely coming. So it's really exciting for those of us that are in science and, trying to help people. Now, let's get to the big one. Adult somatic stem cells. They're the real workhorse. I want you to remember this. It's called mesenchymal stem cells, mesenchymal stem cells. So these are found in bone marrow. They're found in what we call the adipose tissue, the fat tissue, but they're also found in umbilical cord tissues, in the placenta, things like that. These are what's at the center of a lot of orthopedic regenerative medicine, neurologic medicine, and a lot of other things. There's also something called hematopoietic stem cells, which make up blood and immune cells, and that is more for bone marrow transplants, like for leukemia, which has been around for a long, long time. Nothing to do with what we're going to talk about now. Let's talk about the mesenchymal stem cells. Remember, I brought up the embryonic stem stem cells before. This is really important because people say, oh, it's ethical, it's taken from embryos, this and that. So when a baby is born, there's the cells from the umbilical cord, there's the cells from the placenta. Those are actually considered adult stem cells. I just want to say, once it's born, we just call them adult stem cells. We don't say child stem cells or infant. They're just adult stem cells. Why? Because they can't then form those tumors like the embryonic stem cells, okay? And you are harvesting those cells from, I don't know, lack of a better word, the afterbirth, right? It's afterbirth, the stuff that gets thrown away. Now, a lot of parents will, and including ourselves, we saved it for one of our kids, like the umbilical cord cells. But, normally that stuff is thrown away. I mean, what are you going to do with a placenta? Right? You're not going to make a purse with it, right? So it just goes away. And so when we talk about like the placenta, we can harvest those cells and then utilize either the cells themselves. Now, there's rules and regulations in the United States. We'll get to that in a minute. But you can harvest those cells themselves, and then you can utilize that to do some really magical stuff when it comes to whatever. And that's what the overseas clinics are doing. But you can also harvest all of the great stuff around it, all of those signaling molecules and proteins and mRNA and all these other stuff without cells, and also use those products. Now, this is something that might shock you guys that are listening to me right now. The Catholic Church, I grew up Catholic, by the way, okay? Whatever, this has nothing to do with religion. The Catholic Church themselves are huge supporters of the use of these stem cells. So when people are going ballistic, saying how unethical this is and this and that, you know what? Give the Pope a call if you have a problem with it, because even the Catholic Church is behind it. And you know how conservative they are with other things. And so if they're behind stem cells, that means it has the potential to decrease human suffering. And there's nothing unethical about it because ain't nothing happening with those cells. And so we should be doing something with them. And this is something that just bothers me because I don't know why we're still thinking about old ideas. This stuff, like, I don't know why we're talking about stuff we should have stopped talking about in 1990, but we're still talking about it today. And it kind of hurts and brings things back. So let's talk about briefly platelet-rich plasma, or PRP. That is something that is harvested from the blood. It's concentrated platelets from your own blood. We'll get into that probably on another segment because PRP has been well studied. More of you guys know about PRP than you know about actually stem cells. The two big ones, though, are bone marrow aspiration concentrate. It's called BMAC. It's a pretty easy procedure. You basically draw it from we say the hip bone, but it's basically the bump in the back. It's part of your pelvis. You draw that out. You concentrate it down. That's going to what does that contain? It contains these mesenchymal stem cells we talked about, hematopoietic the cells. It has platelets and growth factors. It's a whole biological cocktail. And then there's the adipose-derived, which actually have phenomenal results in certain things. And so you can actually take that from the fatty tissue. Usually it's done around the belly, and most of us have plenty to donate on that front. And so you can take some of this fatty tissue. Again, you can concentrate them down, and that can be used. And then there's the amniotic fluid membranes, the umbilical cord, stuff that's taken from the placenta, including cells or not cells, and then those can be used to create, some of the magic. Then there's the signaling cells, right? We talked about like exosomes. They're these extracellular vesicles. And there's so much research on exosomes. I mean, I can't go into it all today. It's very fascinating, but just plug into Claude or whatever AI program you use, exosomes, and you can read about it for days. They really should be called secretomes because they're these vesicles that then can go out there and basically control the narrative. It's like these signaling molecules that tell other things what to do. You probably, if you guys go to like cosmetic clinics and this and that, they're always using exosomes basically for improving our skin and our appearance and things like that. But they're fantastic to use when it comes to joint issues, orthopedic issues, and a whole host of other issues. And then there's other scaffolds like hyaluronic acid and collagen that you can inject also so, around the knees and stuff. So let's talk about how they're delivered. Okay, because I'm just going to try to keep this broad. In orthopedics, most of the things are going to be delivered utilizing precision techniques where you take a needle and basically put whatever it is, whether it's the stem cells or the orthobiologics, exactly where the defect is. Now, it sounds a lot easier than it actually is. A lot of places are actually doing procedures that don't really have a proven track record of keeping people away from longer term pain and then ultimately undergoing surgical, procedures. So let me give you an example, and it's an example I've talked about constantly here on social media. So if you take knee arthritis, if you inject the cells or the product into the joint itself, unfortunately, it is not the right area. It's going to wash away, and you're not really going to decrease their long-term need to have a knee replacement per se. So there's this famous French orthopedic surgeon, same patient. He took the same patient that both had bad knee arthritis on both sides. On one side, he did an injection inside the bone. It's called the subchondral bone, right underneath the cartilage. On the other side, they put the medicine inside the joint. Guess what? 15 years later, 80+% of the people that had it in their joint underwent total knee replacement anyway. So basically, maybe it helped a little bit, but patients ended up in the same boat. The people that had it in the bone, okay, which is what we do in our clinic. Okay, it's called subchondral, and the excellent doctors across the country that are doing these procedures, you put it in the bone where the damage is right under the cartilage. Only 20% of people needed knee replacements 15 years after the one-time procedure. How is that not on every single billboard in the Twin Cities? Okay, I know why it's not, but how is it not? It's more of an ethical question. Why are we not helping people by doing things that can prevent them altogether from having a knee replacement? Because I can tell you what, if I could push my knee replacement out by 15 years, sign me up. Sign me up right now. Okay? Similar things have been shown in the hip, have been shown in the shoulder. Dr. Hernigou is the guy's name. I mean, he's done a lot of these studies. And again, a lot of times the control is the same patient. So you're really comparing apples to apples. I talked about some of the studies previously in the spine, where there was one fairly, significant study that showed that patients that had these injections of stem cells into their discs actually decreased their pain long-term from a 7 to a 3. Okay, for those of you that have a pain 7, what would you pay to get to a 3? But also showed some increase in disc height, and these people did really well. So the question is, why is that not on the menu of people, of giving people the ability to try to avoid, surgery? Just yesterday in my clinic, there were 2 patients that I otherwise would have absolutely done surgery on in the past who are phenomenal candidates for stem cell treatments. And they both chose to go down the road of the stem cell treatments because of the possibility of avoiding surgery altogether. There's really no there's no downtime with these stem cell procedures other than we have to limit your activity a little bit just so that they don't move around too much. You're not having surgery. You're not missing work. None of those things are happening, and the risks are very low when done by a board-certified, doctor that knows what they're doing. And so you can see why there's so much excitement in the stem cell world. Now, on the flip side, there are also orthobiologics. So I'll tell you what we use in our clinic. So we have these products that you can, there's a lot of them, right? Way beyond the scope of a radio show, and because you kind of need to know the basics first. But there's a product called Regenerative Protein Array that we use in our clinic, and it is basically harvested from the placenta, from the 3 layers of the placenta. It's outside of the stem cells. It's all of those nice signaling molecules that we talked about before. You can take that stuff without even harvesting anything from, yourself and inject those into areas that are necessary. You can do that in orthopedics. We can do that in the intrathecal space, which is next to the spinal cord, to approach all kinds of brain diseases, including depression, anxiety, autism, Parkinson's disease, Alzheimer's disease, all kinds of things. Again, not a cure, but can significantly improve symptoms in so many different conditions where people are really looking for options outside of traditional, medicine. So on the other side of the break, I want to talk a little bit about people traveling overseas versus staying in the United States to have their procedures done, because you're probably thinking, okay, that's nice. This is all cool. Like, where do I go to get some of these things? So we'll talk about that on the other side of the break. We're on AM 950 radio. I'm Dr. Sinicropi. I'm fired up about regenerative medicine and stem cells, and we will see you guys on the other side of the break. Home here. We're on Recharging the Human Battery Radio. I'm Dr. Sinicropi, AM 950. This has been a great, I really love talking about this stuff. I will do a follow-up. Please send me some questions on specifically what you want to learn about. I can dive more into the studies next time, but I can tell you they're coming fast and furious. We're always looking at where things are going, but we can't just look at the studies. I speak to guys that are doing regenerative medicine all over the country. People are having really incredible results. We learn a lot from each other because you can learn different techniques. Then you bring that into your own clinics, and together, we're a lot stronger because people are understanding what works, what doesn't work, and really what works best, because a lot of regenerative medicine really does work well, but can we make it work incredibly well? And that is how, we all learn from each other in that space. So I want to talk about travel. This is really important. We are always bombarded as spine surgeons, or if you're an orthopedic surgeon out there, or you're kind of in the musculoskeletal world, people are always going to come up, hey, I saw this on TV, I saw this other thing. And so you can go and travel to really cool places. There's something called the Dream Body Clinic, which is in Mexico. I had them on my podcast. And then I had Neil Riordan, who is the founder of the Panama Stem Cell Institute. They're doing great stuff. And their kind of claim to fame is that they are able to use the full panel of these mesenchymal stem cells, basically from the placenta, with really no restrictions whatsoever. And so you can get them in massive doses. On the other hand, there is a huge travel cost, associated with that. You have to be in a foreign country. It can become a big deal. Now, I will tell you, for orthopedic conditions and for many of these other conditions that I mentioned before, the difference between utilizing massive amounts of the mesenchymal stem cells from the placenta and using your own cells or orthobiologics is negligible at best. There's really no evidence that those are, because, and again, those studies that I mentioned to you in the knee were just people's own stem cells. No matter how old they were, even if they were elderly, they were getting good results. And we see that all the time. So what I would say is that there are centers here in the U.S., including ours, where you can just travel to. And we have a lot of travel patients with our travel program that come. First of all, it's definitely cheaper. You're home here in the States. You're having, board certified doctors that are doing your procedures, and the follow-up is obviously going to be easier if it's in the United States. Now, again, I think those clinics are doing fantastic, overseas. I'm a big proponent, but what we are doing here is equally robust and able to get patients really, really good results. Just as a very brief anecdote, we just had a guy the other day. He came in, he could hardly use his foot, was in such disabling pain. 24 hours after he came for his travel program, he had one of these orthobiologics. His pain went from like a 9 to a 1. He regained most of the function in his foot. Again, results not guaranteed, but this guy did incredible. He's a former coach of the New York Giants, by the way, not the head coach. He's a former assistant coach of the New York Giants, but has done fantastic. You can see his testimonial. It's right up there on social media. So bottom line is, if you're interested in these travel programs, you can, look us up, Hypercharge Health, Institute for Regenerative Medicine. Happy to take care of you guys and your family. But obviously, most of you that are listening to this program are local. We're located right in Edina, right on France Avenue, easy access. If you have questions, if you have these kinds of conditions, please come in and at least learn about it, or at minimum, ask your doctors about it. And if they don't know about it, then take it into your own hands, take the bull by the horns, do your own research, reach out to us. We're always there. I'm always there for you. Please leave your comments in the message section here. Find me on social media, dr.stefano.md. I answer all the questions myself. We'll see you guys on the next episode. I'm going to keep following up on this particular theme because I know a lot of questions are going to come up. So please get me your questions. This is Recharging the Human Battery Radio, AM 950. I'm Dr. Sinicropi. You guys go take care of yourselves. Be the CEOs of your own health and be well.